Currently, Indonesia is in the transition to a country with an old structure, or an ageing population. In 2019, there were 5 provinces with the number of older persons more than 10%. However, it is estimated that by 2024, almost all provinces in Indonesia will have older persons in population of more than 10%. Indonesia, in all its beauty, is threatened by natural disasters because of its position on the Pacific Ring of Fire. For instance, Mrs. Siti and Mr. Didi. They are some of the many older persons in Indonesia. Generally, older persons have decreased their physical function, but still can carry out their daily activities independently. Meanwhile, Mr. Didi, Mrs. Siti's husband, since 5 years ago, has experienced walking impairment after suffering a stroke. So, to carry out his daily activities and to take care of himself, Mr. Didi still needs his wife's help. Due to their limitations, in disaster situations, the older persons are one of the most vulnerable groups. On the other hand, some older persons have chronic diseases, so their enthusiasm and ability to save themselves are low. This condition makes it increasingly difficult for the older person to avoid the bad effects of natural disasters, so they are at a higher risk of experiencing a crisis situation and negligence. This negligence occurs due to lack of information about the condition of an older person. Based on that, this guideline of minimum health service for older person in health crisis, or MHSOP guideline, was developed. MHSOP aims to be a reference for health workers, volunteers and relevant stakeholders in providing MHSOP in health crisis situations. In its implementation, MHSOP is carried out in 3 phases: pre-crisis, emergency response and post-crisis. Each of these phases has purposes: to ensure availability and accessibility of general and reproductive health services for the older person, to improve the health protection aspects of the older person, to fulfill other older persons' essential needs through multi-sector partnership. During a crisis phase, MHSOP activities include formatting and strengthening of the capacity of the person in charge of the older person's health programme, make plans, provide logistic kits for older person, and be able to fill in MHSOP's instruments, detecting the vulnerability, providing protection and psychosocial support services, as well as identification of health resources as materials for coordination and integration of older person protection services between the health cluster and the protection and shelter cluster. During the emergency response phase, activities such as activation of the person in charge of MHSOP and coordination with the reproductive health subcluster were carried out, preventing the increase in morbidity, disability and death in the older person, providing mental health services, psychosocial support and other referrals for the older persons, preventing and managing the risk of violence, such as reunification of the older persons and ensure their safety, ensure the availability of competent personnel in handling cases of violence, providing safe and friendly toilets for the older persons, management of nutrition for the older persons by ensuring that the older person obtains food assistance in accordance with their health conditions, carrying out environmental health measures by ensuring a clean and hygienic environment, coordinating with other subclusters in providing tents, food and clean water, monitoring the development and the involvement of young adults in evaluation of activities and subsequent planning. Older persons can be empowered according to their conditions and potential, for example, as decision makers and mediating conflicts as they are considered as wise figures. Senior women can help to accompany toddlers or sick people during the evacuation, and also become role models for cultural preservation while in the shelter. The services after the disaster period must be continued in the post-crisis phase, so that continuous monitoring and evaluation is needed, and to ensure older people obtain the mental health service and referral mechanism, and coordinating the activities with other subclusters. Guidelines of MHSOP are also prepared to manage older persons' problems in an epidemic or pandemic situation. One of the pandemics currently hitting is the COVID-19 pandemic, which causes higher mortality in people over 60 years old. Some MHSOP activities that can be carried out include socialisation of the prevention of COVID-19 transmission. MHSOP guidelines for health crisis are designed to ensure that minimum healthcare services for older persons, including aspects of protecting older persons and coordinating other essential needs, can be met. Because Mrs. City and Mr. Didi, along with other older persons, also deserve the best health services during a health crisis. This information is conveyed by the Ministry of Health in collaboration with UNFPA.